Hi all, how are you? Sorry for the small technical error was happened. Sorry for that, my dear students. So we will start our session right now. Don't worry about that. I will give you all the things whatever you want. Sorry for wasting your time. Yeah, we will start the class. So we already know that we are going to be supposed to on the subject which is community health nursing. Okay, so community health nursing is one of the specialized area in the nursing, so where we are focusing on the group of people who are called community, okay, in the particular geographical area. So we will start. So that is what today we are going to learn. Okay, so a specialized area we are going to provide a care for the people who are there in the community. Okay, so community is a geographical area. Okay, so group of people who lived in a particular geographical area. Okay, lot of things is there in this community health nursing. Okay, it is one of the interesting subject too, and we can easily learn this one even it is dry, not that much dry. Okay, so where it is like a history which means we are focusing more on the things which is like that old and terms, plans, everything we will focus here. So that is why little bit like history, don't worry about that. That we can learn with a fun, or we will use some different strategies. Definitely we will learn it. Okay, so we will start the class. I got some, yeah, okay, it's okay. I will start the class. If you are not having if you are not able to hear my voice, please do comment down in the comment box, and whatever the doubt is there means you could have asked in the chat box. Okay, so I will definitely clarify you. Okay, so we will start this one. Okay, so the first one is that community health nursing first. Okay, for the 5th semester examination today we are going to be supposed to discuss about this subject. Okay, so now you listen. So total number of units, 11 units will be there over in this particular subject. Okay, now so now we can see the question paper pattern too. Okay, later on one by one unit wise we can discuss and we can move it on. Okay, so listen, see here the question paper pattern is like longest setup of question, shortest setup of question, short answer and MCQs. I'm not going to tell you to all these things. Why? Because some of the people are going to write again, so they already know. Who are not knowing, who are not able to distinguish the things, for them it will be useful. Okay, so why? Because you people are watching right now, but many people will watch later whenever they are freshly entered to write the examination. So for that reason I will give you, anyhow this will be useful for you too also. Okay, so let me finish it off this in a very quick. Okay, so this one is that question paper pattern, long essay, short essay, short answer, MCQs. Okay, so MCQs we have to focus more from each and every topic. Okay, so if you are clear with the every concept wise, then only you could have able to answer. Okay, you can able to put a right answer in the MCQ. MCQ is like a base. Okay, MCQ is like it's like a game. Okay, it's a very objective kind of questions. Okay, so that is why our preparation needs that pakka clarified concept, clarification, clarity we should have. Okay, so that is the important thing. Yeah, 1 second. Next thing is, from this particular unit only we have the things which is right, uh, I have little bit throat itching is there, so please adjust with my voice. Okay, so next thing is that we are going to supposed to know about the first unit. So 11 units I have already told you. Okay, so in that first unit is all about the community health nursing and the concepts of the community health and community health nursing. Okay, so in this only we are integrated with the public health also. Okay, public health nursing also. So yeah, 11 unit is there. So here you can see that first unit. Okay, so in the first unit, unit number 1, concepts of community health nursing and community health and community health nursing. So in this particular unit you are going to supposed to know about the definitions. Okay, definitions of the community health nursing, pakka for 2 marks questions they will be asked. Okay, so either they may ask about the community health, community health nursing. 3 questions you got. Next, Then concepts of health, different determinants of health, dimensions of health, must and should, one important area, that is you have to cover it off. Next we have to focus more on the thing public health. What is public health? What is the scope of the public health? What are the factors affecting on the public health? Okay, so to secure the good health. Okay, so these are the things are very important. Okay, so hope you got the point. Okay, next one is that review of concepts of health, illness, disease, definition, dimensions and determinants of the health and the diseases. Okay, so already I have told you. Okay, so the next one is it's all about the prevention and its levels. Okay, so either they may ask for the 5 marks question, write about the levels of prevention. Okay, primary, secondary, tertiary prevention is there, no? So that you have to explain. Okay, so primary, secondary, tertiary preventions are there, no? So that you have to explain. Okay, so that is very important. So the next thing is that in this only one more topic is that which we have to focus more on, means health problems in India. Okay, so lot of problems will be there. Okay, for example, population. Okay, so population is one of the problem, poverty. Okay, so and communicable health diseases. Okay, non-communicable health diseases. So lot of problems are there. Okay, so regarding the health related problems in which is present in India, that you have to study. Okay, so while studying that one, according to their objectives and causes of that particular health problem in India. Okay, so those are the things you have to write it down in the examination. Okay, so far first unit finish. Okay, so this much only you focus here. Okay, don't put much effort on the simple blah 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 things. Okay, so only you put a effort here. Okay, so these are the high yielding topics according to your syllabus. Okay, so where I'm telling you what are the things which will be there in the here, no? So that is all related to your syllabus. Okay, so rather than this also you have to gain the knowledge only for the purpose which is for the MCQs. Okay, MCQ, you want to attend for the MCQ correctly, you have to score out of 7 or how much they will ask, around 12 questions they may be asked. Okay, how many questions they may ask also, no issues. So you have to clarify your things with the proper guidance and the proper study. Okay, so proper revision, recall. Okay, so if you do this one, definitely which is going to be helpful for you. Okay, next unit we will move towards the next unit. Okay, so second unit. So the second unit is that, hi ma'am, who is that? Tanuja VC Tanu. Okay, hi dear. Hope you are able to hear my voice. Okay, so I think hope you got the first unit over. So who are from Kerala, people are telling that my English was bit of fast, something like that I got. Okay, so don't worry dear. So you are not able to understand means we will little bit I can tell in Malayalam also. I know little only, don't worry about that, but I will speak slowly in English only. Okay, so I can understand your problems also. Okay, so because now we are also having a very short time, duration will be very less, so I need to finish it off. That is why, even though I will try to finish it with the proper speed only. Okay, so don't bother about that and try to speak in English only. Even you are spending time with the Malayalis or your mother tongue language also. See, English we need, right, for education purpose. Speak with them in English only. In all colleges that rules will be there, but even though students will not going to follow it, right? So even though you speak with in English, that will make sure you to get the classes. Okay, so English is only the language, is only it's not a barrier for you to learn the things. Okay, so try to speak in that. If you are not getting, please do one thing, you tell me, I will definitely try to speak in Malayalam. Okay, I will learn and I will speak. Okay, so okay, now we can move towards the second unit. Okay, so here only few of things I was left, I told already, but I will tell you once again. Okay, so from all these things, no, one concept I have left from the first unit, role of community health nurse. Okay, so certain things which will be there, qualities of the community health nurse, role of the community health nurse. Okay, educator, leader and organizer, planner. Okay, so then advocate. Okay, and how can she will be she will mainly focus a role in the health education. Okay, So health education regarding the family planning, each and everything which will be present in the community. Okay, so there she will be focused more, right? So that is the very important concept, there you have to focus. Okay, so now can I go to the next unit, which is that healthcare planning and organization of healthcare at various levels. Okay, so it is an evolution. Okay, so healthcare that doesn't exist, yesterday it was born, today it was exist. No, it is not like that. It is the thing which is, um, which is very means from the era to era it has been evolved and it has been developed a lot, and it has been, now we are in the modernized culture of medicine. Okay, so we are following the modern medicine concepts. Okay, so that is how the same thing here also, the healthcare planning and organization, and it's a lot of things like various levels will be there, no, primary, secondary, tertiary. Okay, so and we have lot of plannings. Okay, so 5-year plans, have you studied? Okay, so hope you guys are studied. Okay, so that one, first 5-year plan, okay, second 5-year plan, third 5-year, fourth 5-year, fifth 5-year. Okay, so that 5-year plans are very much important. You have to focus more on that and study. Okay, so one 5-year plan must and should they will ask, okay, for the 5 marks question, or it is and the committees are there, no. Okay, so those committees and commissions will be there, no. So that is also very important. From this particular concept, one question I am expecting, so focus more on there. Okay, so now I will go to the next topic, which is a health participation of community and stakeholders in the health planning. Okay, so how this discuss the healthcare delivery system in India at various levels. Okay, so the healthcare delivery system in India, like PHC, COC, and we have the district level. Okay, so primary healthcare sector, CHC, and elements and principles of those things. Okay, so CPHC through subcenter or health wellness center, H2HWC. So this much is there, so you have to focus more on this. Hmm. So healthcare delivery system in India, various healthcare PHC, principles of that staffing pattern in the PHC and as well as CHC, and as well as subcenter, health wellness center. Okay, so subcenter or health wellness center, both are same only, don't confuse with this, and the staffing pattern over there, and what are the principles will be there, and what kind of treatment will going to be provide in the sub-center. Okay, so the staffing pattern in the PHC, what is the staffing pattern, how many peoples will be there, what are the principles they have to follow. Okay, regarding the immunization, what kind of healthcare facilities are going to be rendered in the PHC, what is the referral system which will be there in the PHC to CHC, CHC to the district level hospitals. Okay, so that is how we are going to refer the patients for the higher hospitals. Okay, and team members must and should, and the role and responsibility of the each and every healthcare system team members, you have to focus more. Okay, so this is how you need to cover the concepts. Okay, so only studying about the PHC is the primary healthcare center, these are the things which will become, and this kind of treatment we are going to provide, and here we are following the prevention methods like primary, secondary, tertiary preventions, and that level of care we are providing primary, secondary, tertiary care. And next one is that we are going to no, it is not like that, this is the way you have to study. Okay, so that is, if you are studying in such a way, this will going to be easy for you to helpful at the time of revision. Okay, so like that you study. Okay, focus here about the PHC, CLC referral system, that subcenter even too, and you have to focus on more regarding the district health. This much. Next one, we are going with the sustainable development goals, SDGs, primary healthcare and comprehensive primary healthcare, CPHC, and elements principles about that only. Okay, so already have told role of MLHP. Okay, mid-level health provider. Okay, and CHP. Okay, community health provider, CHO, what we will call no, MLHP, CHP will be there, right? So their role, what is their role? Providing immunization for the vulnerable group, and for example antenatal mothers, and for example under 5-year children's. Okay, to secure what are the vulnerable group will come in the community, my dear students. So the students were like, it will help to get pass mark, definitely da. definitely it will help to get the pass mark. Okay, so if you revise with me, definitely you will pass whatever the concept I will tell you. Yeah, Anjana something, right? Anjana was asking. Anjana Biju, yeah, it will be helpful you to get the pass mark. Okay, so yeah, whatever I am telling you, no, like that you study. Okay, so MLHP mid-level healthcare provider. Ale. So same like that, you have to focus more on the things which is, you know, CHP also. Then role and responsibility, designation of them, what is the quality, and their principles will be there, certain objectives will be there. So that is 2 to 3 pages of MLHP information is there. Okay, so don't going to put a more effort to learn about that. Just do Google, or if you can't able to get it, MLHP one PDF is there. So if you study that one, it is very nice. One trick I will tell you, that is which is present in the Scribe. Okay, Scribed one website is there. There you go and search, you will get it. Okay, so that you study. Next, in this particular unit, that only they are asking role of MLHP. Okay, or expand MLHP 2 marks question they will ask. The next one, national health policies and regulations. Certain national health policies will be there, so that you study thoroughly that policies. Okay, so the next one is National Health Mission NHM and National Rural Health Mission NRHM. Okay, NHM and NRHM. So, what is the difference between National Health Mission and the National Rural Health Mission? So, this is concentrating on the rural areas, NRHM. So, that you have to focus more. Okay, so that is the thing you have to focus more over here. Okay, so now in Instagram also live is there. So, if you can able to attend there also, you could have attend there. Okay, so the next thing, which is, yeah, so these are the things will be there. National Urban Health Mission. Okay, so NUHM. Okay, NUHM. Okay, these three concepts you focus. U means urban, R means rural. Okay, so only that difference is there, and their modalities and the principle will may vary comparatively to the rural and to the urban. The facilitation of the providing health care for the people, certain changes will be there. Okay, so both you have to compare and study. That will make sure you to be get the good marks. Okay, so that is over. Next one, we have to focus on the National Health Protection Machine. Okay, mission. Okay, so that is, and Ayushman Bharat. Okay, so they will definitely ask about the Ayushman Bharat and Pradhan Mantri Jan Suraksha Yojana. Okay, so that and all they used to ask, and as well as the universal health coverage, the complete health coverage will they are going to be ask you. Okay, so those are the things are very important for you to get the good marks in the examination. So should not leave any concept whatever I had told you. So just to study first, whenever you are going to write about that particular exam. Okay, so if they are asking about the suppose one national health policy or objectives of the 5-year plan. Okay, what you have to do, suppose you have to do the things like first you write about the particular 5-year plan. Okay, write about the objectives of the first 5-year plan. Okay, so this is how you need to be answer. Okay, so that is how if your answer means it, definitely you will get the good marks from the second unit. Okay, whatever they may ask also you can write it off. Okay, so role and responsibility of the MLHP and CHP, don't forget to study. Okay, so these are very important. They are going to ask for the 2 marks questions, or it may be for the 5 marks questions. Okay, next we are moving towards the third unit, that is environmental science, environmental health and sanitation. Okay, so environmental science, environmental health and environmental sanitation, that is the third unit. Okay, unit number 3. So this is all about the things which is related to which semester. Adarsh, hi Adarsh, which semester? This is 5th semester, first community health nursing. Okay, so for the first community health nursing, we are taking the classes for the examination preparation. Okay. Yeah, you are asking which semester, you are in which semester? Could you please comment it down? Okay, let me take a class. So this is environmental science, environmental health and environmental sanitation. So where we are living in the community, right? So what is the most thing which is affecting us? Environment, okay, our surrounding area. That is why in nursing we used to tell. So according to the Florence Nightingale, what she had given, the environmental theory, our environment will be good, our health will be good. Okay, so that is why we have to focus more on our environment. Okay, so if you are not properly maintaining our environment, we are not supposed to properly maintain the sanitation facilities in the environment, definitely we are going to get the things which is affecting our health. So that is one of the drawback. Okay, so India is a country, we are having a lot of population, we can't able to much efforts on this maintaining a proper health of the environment, but even while we have to focus more on that to make our country to be get good health of the population. Okay, so the natural sources like natural sources, renewable sources and non-renewable sources. Okay, natural resources we are going to be studying this particular, in that also renewable and non-renewable. Renewable means we can able to use, it can be able to recycle. Okay, so we are using renewable. Okay, re means again. The next thing, non-renewable, this one we can't able to reuse it. Okay, so then, and it is not going to be decay also. Natural resources and associated problems like forest resources, water sources and mineral resources, food resources, energy resources, sand resources, sand and land resources. Okay, so this land resources and everything will going to be affect how we, these are the resources which is going to be affect on our body. So 2 marks I am expecting from this particular topic. Role of individual in conservation of natural resources in equitable use of resources for sustainable lifestyle. Okay, so the next one is ecosystem. In the ecosystem, it is a huge concept. Okay, this concept, structure, functions of the ecosystem, types and characteristics, grassland ecosystem, desert ecosystem, aquatized ecosystem. Okay, so aquatic ecosystem and energy flow in ecosystem. So these ecosystem full complete one question I'm expecting. Okay, so there most of the time they can ask about the types of ecosystem, characteristics and or else explain the desert ecosystem. Okay, it is a general concept, my dear students. So don't push much and effort on this. We already studied this from 10th. Okay, so we have from our schooling we have studied this environmental science, no? So EVS whole are studied, so that will make sure for you people it doesn't makes you more complication. Okay, next one is that environmental pollutions. Okay, this is the actual weightage area from this, and before going to that environmental pollutions, I will tell you about the biodiversity. Okay, so that is also one of the concept. So biodiversity is there. Okay, so biodiversity, from the biodiversity also we are having the chance to get the questions. Okay, classification, value of biodiversity, threats to biodiversity and conservation of the biodiversity. Small concept, you can expect the questions like what define biodiversity in the 2 marks and steps to conserve the biodiversity, like that you will get the question, or it may be for 5 marks. I am expecting very less this question, so leave it. The next one, environmental pollution, must and should 5 marks, one question will be there. So surely you have to focus more on this particular. Introduction, causes, effects and control measures of air pollution, water pollution, soil pollution. Okay, 3 pollution. Okay, this land pollution, soil pollution, so both are same, so that you have to focus. And marine pollution, noise pollution, thermo pollution, and nuclear hazards and their impact on the health. Okay, so while writing this, so try to focus more on the what is air pollution, and after that what are the causes of the air pollution. For one example I'm telling. Okay, then what is the impact of the health, impact on the health due to the air pollution. Focus like this. Okay, so distinguish the question like this, and in order to these factors you have to answer. Okay, so that is the thing which will be there. So hope you understood, right? Next we will move towards the climate change and global warming, heat wave, excessive of the heat wave, and example, heat wave, acid rain, ozone layer depletion, waste, land reclamation and its impact on the health. Okay, so this land reclamation is also one of the important questions, and that you have to focus more on the ozone layer depletion. There may be a chance to ask for the 2 marks questions. Okay, so the next one, social issues and environmental sustainable development, urban problems related to energy, water and environmental ethics. Okay, so regarding the urban what are the social issues we are facing due to the environmental sustainability development. Okay, so acts related to environmental protection and deprivation. Okay, so that certain legislative acts will be there, that also you could have studied. Okay, so this is all about the environment. Okay, so this is all about the environment. Okay, so natural resources, renewable, non-renewable, everything we have discussed. Okay, so and again we are going to see about the role of individualization in the conservation of natural resources. That is not a question, but they are asking about the what is the role of the community health nurse in order to prevent these pollutions and all. Okay, how it will be impact on the health of the population, that will be definitely we are expecting. Next one is that we have the sanitation. Okay, so environmental health and sanitation. Regarding the sanitation, the concepts of environmental and sanitation. Sanitation means we are going to be cleanse the environment. Okay, which means we are taking care of the environment in a clean way. Okay, so that and next one, concept of safe water, so water, source of water and waterborne diseases, and water purification process, household purification of water. Okay, so we are focusing more on the disease which is caused by the water. Okay, so and we have to, have you observed that in the community posting we used to go to the homes and we are checking everything. Okay, so whether they are maintaining the cleanliness in the water, especially in the climate change season. Okay, so now it is, we are in the monsoon season, right? So in the monsoon season what it will be happen, there is a chance to store the water in the certain mugs and the barrels, plastic barrels they used to use. In the community area we have low class people also, high class people also. Have you know about this human standardization? Okay, so this stratification will be there. No, based on that stratification we are having the lot of different groups of people in the community. Okay, so all are not rich, all are not poor. Okay, so common people also will be there, like middle class people will be there. Okay, upper class will be there, lower class will be there, poor people will be there. So those people are they are following certain different kinds of yeah, fifth semda. Who is that? Shumil, Shmil. Okay, so fifth sem only, fifth sem part community health nursing part 1. Okay, so the fifth sem we are discussing. In that what I'm telling about this water purification. Okay, so that is also one of the important. Have you went this water purification plant as a part of your community health nursing subject? Okay, so you have to visit that one. Okay, water purification, how they will purify the water and how we are reusing those things. Okay, so that then physical and chemical standards of the drinking water quality and test for assessing the bacteriological quality of the water. Certain test will be there that you have to focus. Okay, next one, concept of the water conservation, rainwater harvesting and watershed management. The next one, solid waste management of human excreta disposable and management of the sewage disposable management. Okay, so these are the things. Okay, so in the sanitation you have to focus on the water purification and which is related to the water. All the things you have to focus. From that one question we are expecting 2 marks. The next one, we have to focus on the things which is like human excreta depletion. Okay, so that how we are going to be used, what are the methods we are following. Okay, landscaping method, that a lot of methods will be there, no? So those methods you have to study. Okay, next one is commonly used disinfection, sorry, insecticide and pesticides. Okay, so for waste management only, so we are using the certain ma'am, which topics are important for exam? That topics only I am telling da. Now I am discussing about the third unit, sanitation. Okay, so environmental science only. In that the important topic which is related to the sanitation I am explaining. Okay, so you listen that only in this particular topic we are sanitation, you are going to focus more on the environmental health sanitation. Okay, so in that also water purification, regarding the sources of water and how we are going to use the water, means purification and the process, household water purification of the water, that. And next one is physical and chemical standards of the drinking water. Okay, the quality, how to check by using the different tests. Okay, that you have to focus in the when it comes to the water. Next one, solid waste. Okay, so in that also, in water you have to focus on the rainwater harvesting, that will be there. Okay, so that, Christy, this is not for you da. Christy is watching this one, but he is not having the subject. But you are already written, I think. Okay, you watched, no issues. The next one is that solid waste management, human excreta disposable. Pakka they will ask. Okay, so if the paper will come tough, definitely this question will be there. Okay, so hope easy only it will come, but this is a very important point of your examination. Okay, so next one is nutrition assessment and nutrition education. Okay, so these are the whatever I am discussing, no, this third unit and fourth unit. Now I will go to switch to fourth unit. Okay, okay. So unit number 4. So unit number 4, which is all about the nutrition assessment and the nutritional education. Okay. Very simple. Okay, so this is very simple. This is very simple kind of topic, and here we are expecting the types which is like, means nutritional assessment. Vulnerable group is there, antenatal mother, postnatal mother, diabetic patients. Okay, so then like common diabetic patients, hypertensive, non-communicable disease patients will be there, and as well as we have the vulnerable group like under 5-year children's, infants will be there. For them the nutrition is that enriched in the breast milk. Okay, so we have to encourage the mothers to provide the breast milk and all. Okay, this will also will comes in the say here only. Okay, so general I am telling that one. Okay, so where in this particular unit you have to focus on the concepts, types and meal planning. Okay, so meal planning is one of the very much essential thing. As a nurse you should know what kind of food you have to supposed to encourage to provide for the patient who is having the hypertension. Yes, our answer is that it is very low intake of the salt. Okay, low salt diet we are going to provide for the hypertensive. Okay, so and we are going to we are going to supposed to tell about this low carbs diet for the whom we are supposed to tell about this one, diabetic patients. Okay, and we have to provide such a iron rich and such a calcium and all means enriched balanced diet. We are going to support nutritious diet to provide for the pregnancy people. Okay, so nutritional assessment, nutritional rehabilitation, nutritional education, nutritional deficiencies and nutritional program, these are important. Yes, yes, very nice. That only important. And along with that, we have to focus more on the meal planning. Okay, so whatever he told, no, he took a time and typing that one. So along with that, you have to focus on the meal planning. Okay, while writing the meal planning, aims and steps and diet plan. Okay, so that also 2 marks we can expect. And nutritional assessment of the individual, family and community by using proper methods. Okay, so next one in this particular nutritional education purpose and principles, methods and rehabilitation, whatever he said that only. So, and next one is that we have to focus more on the foodborne disease and food safety. Okay, so certain diseases which will be regulated by the food also. So, those you have to focus under that definition, burden and causes and the classification, signs and symptoms regarding foodborne diseases, transmission of the food pathogens to toxins. Okay, food pathogen and toxins means pathogens is that the gens means germs which is causing the disease, patho means disease, gens means germs. Okay, so which are the bacteria, the virus which is transferred through the food and causing the toxics in our body or affecting the digestive system and causing lot of diseases, that is we will call it as a foodborne. Okay, so early identification, so for example most of the time we are getting the food poison one, and another one is that diarrhea. Okay, so due to this one lot of people will going to be suffer. Okay, so sometimes it will be spread more. Okay, so sometimes gradually it will be increase in the population. Okay, so that is, and food poisoning and food intoxication. Okay, so that is also very important. Epidemiological features, signs and clinical that is what clinical manifestation, types of food poisoning. Okay, so food poisoning you have to focus more, and food intoxication 2 marks they will be asked, or 5 marks features and prevention and control measures also they will be asked, and public health response of the foodborne diseases. Okay, so these are the important things in the 4th unit. Next one we will go to the communication management and health education. Okay, so here no communication, this entire process will be there, no, that is will be very much important. Okay, behavior change, communication skills, communication, human behavior, health belief model. Okay, concept and definition and ways of influencing behavior, steps of behavioral change. Next one, techniques of behavioral change, guiding principles in planning activity. Okay, steps of this one, behavior change communication activity, then social and behavioral change communication strategies, that is what SBCC. Okay, so 4th unit I am speaking this one, sorry, 5th unit, communication and management of health education. So, in this particular unit, the entire process is very important, and the meanwhile, you have to focus more on, yeah, counseling. Very nice. So, in order to counseling, you have to focus more on this BCC, behavior change communication, and SBCC. Okay, so that is what social and behavioral change communication strategies. Okay, so that techniques and collect social history from clients. Okay, so that how we need to interact with the people, the communication is very important. Okay, so once the patient will enter to the hospital, or you are going to be in the field. Okay, so this is the community health nursing, no, you have to go into the field only, you are getting the things. Okay, even you are Malayalis, even you are Tamil, even you are Telugu, no language barrier my dear students. Wherever you will go, try to learn the local language and try to interact. Okay, so I have have seen so many of you go to the community posting, and they will be only say akka, anna, hesru, this much only they used to learn. Okay, try to learn. Okay, before actually in our colleges and all, we used to prepare for this posting before 1 or 2 weeks. Earliest only we are giving the plan. No, in between that, at least learn how to collect the data for a general history collection. How much you need, that much you easily you can learn. You could have go and interact with them. Okay, so then only you will boost up your knowledge by assessing the patients in the community health level. Okay, in the community sector, so they will also interact with you. Okay, even in this particular urban area, I have seen people are not going to let you to ask the questions, or they were not going to supposed to let enter to their house to collect the data. But okay, it is okay, you have to approach them. Okay, so that is our duty, right? Duty alle. ICDS is important. Yes, that is very important. Definitely they are going to ask one question about that. Arya, definitely ICDS is important. Da? The next one, in the communication methods and overcome them. Okay, so communication methods are important. Health promotion and health education methods, techniques, and audio visual aids. Okay, regarding this health education, so where we are focusing more on the health educations, family planning and all, we have to provide the health education. Certain techniques we are using audio visual aids. Okay, so most of the times we are using certain things. Okay, so audio visual aids. Okay, we are using the AV aids. We used to conduct a lot of role play in the community. Okay, so we used to conduct, we have to encourage them to overcome from that particular problem. So we have to provide the health education. Okay, so certain things, for example, nowadays mental health is keep on affecting on the people, right? So what we are doing, we have to focus more on the digital detoxification. We used to conduct lot of programs on that and the community sectors, and we are educating the people. Okay, so however the trend has been changed and upgraded, so in order to avoid those consequences, we have to provide the education for the people. Okay, so for the vulnerable population, yes, we are going to be conduct certain meetings in the Anganwadis and all for the breastfeeding mothers. Okay, so there how we are going to be, yeah, how we are going to be helpful, we are going to provide education for the breastfeeding mothers. We are using our nursing students and all used to make lot of charts and all. Okay, so this breastfeeding techniques, how to hold the baby, what is the position. Okay, so certain methods how to hold the baby, football position will be there, no, so we have to hold in that. So that and all, the newly mother will be there, no, so she is not able to understand. Okay, so that and all the things which will be taken initiated by the nurses and the healthcare provider, which will definitely going to be affect on the newly mothers, right? No, so this is a part of the health education. Okay, so that techniques and all will be there, no, that you have to list it down and write about the role of community health nurse in the providing the health education in this particular question if they may ask. Okay, so like this you write. So next we are going towards the 6th unit, community health nursing approaches, concept, roles and responsibility of the community health nurse personnel. Okay, so this is all about the community health nursing. Okay, so community health nurse. Okay, so nursing and nurse. Okay, so both are different only. Community health nursing is a specialized area. Community health nurse is a healthcare professional or the personnel to provide the care in the community health sector. Okay, so she is the worker. Okay, so there you have to focus more on the things which is like nursing process. What are the nursing process in the community? Same like here also, planning, diagnosing, that only which will be there, but little bit of different from the medical things. Okay, so that next epidemiological approach. Okay, so epidemiological approach, problem solving approach, evidence based approach. Okay, so these are the things we have to focus, because here it is a different, here it is a different. Okay, so in MedSurg it is a very different kind of programs has been planned, and here we need to implement those things which is like we have to approach them, everything we have to collect the evidence. Okay, so lot of things will be there, and empowering the people to care for themselves. We have to provide a empower in the sense strengthening the people to care themselves. Okay, so whatever it may be happen due to the COVID, lot of deaths we have seen, right? So by the time whatever healthcare team has been do, So they have to educate, they have to provide education regard lot of in the phone calls and all. We have listened lot of informations, right? So wear mask, maintain the social distance among the people, keep yourself isolated, okay? So like this kind of, so these are the forms of the health education through the mass media, okay? So that and all the things which will be taken by who? Healthcare providers, especially the nurses are the frontline warriors, okay? So in the community, that much is very important. Nursing approaches, nice, nice, very nice. Next one is that primary healthcare and comprehensive primary healthcare, okay, PHC, CHC. And next one, home visit, okay. In the home visit, you have to focus from the history collection, okay. So first we will conduct the survey, okay. So survey we used to conduct, okay. So after that we used to do the numbering of the area, mapping, road mapping, it will be there, okay. So everything you have to done, and later on you have to visit the homes, okay. So in the homes you have to collect the data, okay. So the data collection will be there, and principal process and techniques, back technique, okay. So that back technique, keep it in your mind, define back technique, okay. So what are the compartments which will be present in the back technique? 2 marks question for sure, okay. So the next one is that quality of the community health nurse, roles and responsibility of the community health nursing personnel in family health services, and principles and techniques in the counseling, okay. So this much is there. And one more thing, family health services, immunization, and as well as the family planning procedures, okay. So regarding this one, this permanent methods, temporary methods will be there, no. So that entire flow chart you have to put it on, okay. So if they are asking, this much is enough, okay. Next one, we are more move to the seventh unit. Seventh unit is assisting individual and families to promote and maintain their health, okay. Assessment of the women and children, and assessment of the individual families, okay. Review of the child health nursing, medical surgical nursing, OBG nursing, okay. So in the first one is assessment, we are focusing on more on the all the sectors of the nursing, okay. One second. Women empowerment, female feticide, nice only. Ah, you only tell da everything. Nicely you are giving informations. Who is this? Muhammad Ali. Muhammad Ali. Nice da, you know very well. Okay, so here we have to focus on all the sectors of the nursing, okay. So next one is women and children. In that also adolescent, elderly, etc., means children, and monitoring the growth and development on milestones, okay. So here we are focusing on the under 5-year children, okay. So from 0 to neonates, infants, okay. So there we are going to focus under till 5-year children. We have to provide a lot of care for them, okay. And the immunization schedule will come here, so that you have to focus, and monitoring the growth and development, that anthropometric measurement will be there, no. So that, and whatever the things which we are using, okay. So that also you have to focus more, okay. So for 1 marks question, my MCQs questions, weight checking bag, what we will call for that bag, and we are using this one tape, no. So the tape name I will not tell right now. So you tell me the tape name, they may ask for the MCQs, okay. So shoulder we are taking the measurement, no. So the tape name and this eye chart, okay. So certain names are there, so you remember, go and study that those names. If I'm telling, you will definitely going to leave it that questions, okay. So for that reason, for eye chart, this chart will be there, no. So this chart, for this one certain name will be there, okay. So that you have to go and study once. Next one is that that I already told, body mass index. Next one is social development, temperature and blood pressure monitoring, vital signs, menstrual cycle, okay. So next thing is very important, is menstrual cycle. They may ask for the 2 marks, it may be here, okay. I'm not expecting from here. Only the things I can expect, breast self examination and breastfeeding techniques, okay. So the next one, breast self examination, and here they may ask for this warning signs of various diseases, okay, like cancer and all warning signs will be there, no? So various diseases, all the disease conditions, warning signs will be there, okay. Just list it down and tomorrow morning before going to the examination, remember and go. And urine for sugar and albumin, blood sugar, hemoglobin. Okay, so these tests, this is for the practical purpose, it will be there. So betadine test we have to do in the where in the community level. Okay, so that betadine solution test, okay, so Benedict test what we will call it, okay. So Benedict test will be there, so we are using the Benedict solution, sorry, betadine solution I told, it is a Benedict solution. We used to use the urine sugar albumin checking, okay. So for that reason we used to use that one, that entire procedure they used to ask, okay. So the quantity you should remember there, how much, how many ml of Benedict solution you are going to supposed to use, and how many drops of urine you are supposed to put into that, okay. So what is the indications, brick red, yellow, green, okay. So this much color and brick red it is there means it is for sure it is having the, he is having the sugar, okay. So we used to done in the community health sector, okay. So that procedure they may ask, okay. So that is also one of the important question, okay. Next one is that hemoglobin test is there, one person, Taliquis paper, okay. So this Taliquis paper hemoglobin test, that one procedure is there, okay. One paper will be there, this side, see, paper will be there, this side color coding will be there of the blood, and this side we need to take the blood and we have to put it like this and we have to match, okay. So like this procedure one is there, that is what Taliquis hemoglobin paper test, okay. So that you have to study. Next one is that, what is it? Oh, breast self examination, testicular examination, yes, that is also it will be there. And immunization, counseling and diagnosis, management of common disease at home and healthcare level based, this and all it will be very common. One second. That much only, okay. So after that we have this sensitize and handles issues affecting the healthcare development of the family, okay. Woman empowerment, woman child abuse, woman and child abuse, abuse of elders, female feticide and commercial sex worker, that is what, prostitution and substance abuse, okay. Substance abuse, this is for sure they are going to ask from this particular unit. And next one is utilize community resources for client and family, okay. So trauma services, old age homes and orphanage homes, okay. Orphans means what, you tell me. Then homes for physically challenged individuals, home for dis for disputes, and palliative care centers for palliative care, and hospice centers and assisted delivery, sorry, assisted living facility, okay. So this much will be there. So here we have to focus more on this women empowerment, prostitution and as well as this one commercial sex worker and as well as the elderly abuse, okay. So this much we can have to, female feticide and that act also will be there, that is also important, okay. So these are the very important. Next, can I move to the 8th unit? In the 8th unit we have the questions like, you know, introduction, epidemiology, epidemiological approaches and process, epidemiological concept, definition and the triad will be there, no, okay. So epidemiological triad will be there, no. So that triad you have to focus more. And next one is epidemiology, aims and use of epidemiology, epidemiological models of causation of the disease and concepts and disease transmission, mode of transmission, direct, indirect and chain of infection, time time trends or, one second, only that much they are asking, Muhammad. Epidemiological methods and epidemiological theories, okay, only that much they are asking. the concepts also they used to ask. Okay, so entire things you have to study. Okay, so should not going to be only particularly the things. Okay, so I know that you are going to be in hurry worry that I need to focus that this and all. No, it is not like that. Once you start to study the things which is on based on the things which is important, you have to focus in that. Also you have to know the knowledge of the things. Okay, I'm not telling you to mug up this one. Okay, so you have to focus there also. So the next one is that prevention of disease, investigation and epidemiological communicable diseases, investigation of epidemic communicable diseases, use of basic epidemiological tools to make community diagnosis for effective planning and interventions. Okay, so this is all about the epidemiology. Next is the 9th unit, communicable disease and national health programs. Okay, communicable diseases are the diseases which is going to transfer from one person to another person, that we know already. Okay, so list down that while writing the answer, list down all the communicable diseases. And next one you have to write about the communicable diseases. In that also vector borne diseases. Okay, so lot of diseases are there that you have to according to the classification you have to write. Okay, so the epidemiology of the following vector-borne diseases, the prevention and control measures will be there. What are vector-borne diseases? They will be asked. This is for sure they may ask. Okay. Next one, screening and diagnostic following conditions, primary management and referral system and the follow-up. Okay. So the referral system about malaria, filariae, cholera, Japanese encephalitis, dengue, chikungunya, they may ask. Okay. Any one of the disease condition they will ask. And communicable disease, infectious diseases. In that epidemiology of the infectious diseases, prevention and control measures, screening, diagnosis of the following condition, primary management and referral follow-up, leprosy, tuberculosis, vaccination will come. Okay, and then certain programs will be launched to control those communicable diseases, that you have to study thoroughly, and the objectives of the program, and as well as when it was invented and who established. Okay, national health and family welfare means central national health and family welfare only going to be established those programs to in order to eradicate or prevent the disease conditions. Okay, so for example tuberculosis eradication program will be there, no, any TCP, so any eradication TB control program will be there, no, so that you have to study thoroughly. So if you are studying that one, means you have to write it down first what it is the program, when it has been changed. Okay, so it has been changed. Okay, so from first it is their national tuberculosis control program, so now it is eradication, elimination or eradication will be there. Okay, NETB. Okay, so P. Next one is that measles, enteric fever, viral hepatitis and HIV AIDS, RTI. Okay, reproductive tract infections, HIV AIDS and sexuality transmitted diseases, reproductive tract infections, diarrhea, respiratory infections, COVID-19, helminthic, soil and food transmitted and parasitic infections, scabies and pediculosis. Okay, treatment of the pediculosis. And next one, communicable disease of zoonotic diseases from the animals. Okay, so from transferring from the animals. Okay, so that prevention, control measures, everything you have to study. And screening and diagnostics test, whatever the diagnostic test you have to follow. Then primary management and referral system for the zoonotic diseases. First thing is will comes in the rabies. Okay, so identify, suspect and primary management and the referral to health facility and providing the immunization to boost up their immunity against this rabies. Okay, so we have to provide a vaccine. Okay, rabies vaccination. Then role of nurse in control of the communicable diseases. Okay, so this much is very important. Okay, so this you have to study. One is that one second. Just a second. I'll get back to you. One second. Yeah. Okay, so after that come to the programs. Okay, universal immunization program, diphtheria, whooping cough, it is also called as pertussis. Okay, so there may be a chance to ask in the multiple choice question that you have to study tetanus, poliomyelitis, measles and hepatitis B. Okay, so this much. And national leprosy eradication program, NLEP. So write it down, what is national health, national leprosy eradication program, then objective, when it was established, who it has been established by, national health mission and family welfare. Okay, so the national health and family welfare. Okay, so the next one is that you have to focus on the revised national tuberculosis control program, RNTCP. Okay, so the next one is that integrated disease surveillance program, IDSP, enteric fever, diarrhea, respiratory. And next one is National AIDS Control Organization, NACO. And next one, National Vector Borne Disease Control Program and National Air Quality Monitoring Program. Any other newly added program will be there, that is also the Suman and all will be there, no? So that also you have to include it here and you have to study it down. Next one is non-communicable diseases. Okay, same like this only, non-communicable diseases, you have to write all the non-communicable diseases according to one communicable diseases, whatever the preventive measures, what is the role of community health nursing preventing the non-communicable diseases. First one is that in non-communicable diseases, first we are going to study diabetes mellitus. Okay, type 1 type 2 both you have to include, hypertension. Next one is cardiovascular diseases, strokes and obesity. Okay, so these are. Next one, blindness. Okay, so if they are asking 5 marks, blindness is the one of the highest yielding point. Okay, so question. The next one is that deafness, blindness and thyroid diseases, injury and the accidents. Okay, that much you study. Next, 2. Okay, so non-communicable diseases 2. There you are going to study about the cancer, cervical cancer, breast cancer, oral cancer, epidemiology and specific cancer of risk factors. Okay, so then prevention and referral system and screening, diagnosis, signs and symptoms and early management and the referral, palliative care, role of nurse in preventing the cancers. Okay, so that you have to study. There nothing will take you more time. Okay, so like this if you study. Then national health program regarding the non-communicable diseases are like national program for prevention and control of cancer, diabetes, cardiovascular disease and stroke. Okay, NPCDCS. Okay, this one. Next one is national program for control of blindness, national program for prevention and control of deafness, National Tobacco Control Program, standard treatment protocols used in the national health programs in the non-communicable diseases. This much is enough. Okay, so don't think that madam is telling all the things. No, in this only one will come. Okay, I'm not telling this only will come. In this only one will come. So for that reason, if you study all these things, definitely you will get one. If you neglect one also, if it will ask means what you will do in there. Next one, school health services. This is the last unit. In the 11th unit, school health services. The objectives of school health services, midday meal scheme will be there, that you have to study here. Then health problems of school health children's, comprehensive components of the school health services, maintenance of the school health records. Okay, so this may ask, and they will be asked most of, write a note on the school health program services. Okay, so like that they used to ask. So this is all about the 11th unit. Okay, so here what we need to do is that, so these are the school health programs which they are going to be affecting more on the things which is most probably role of nurse. Okay, role of nurse is most probable thing that which we can able to expect it over here. Okay, so role of nurse in the school health program, or 2 marks school health record maintenance. Okay, this much they will be asked. Okay, so far we have discussed all the units and I have told you where you have to focus more. Okay, so female feticide, or it may be the things which is like national health program and leprosy they may ask. Okay, tuberculosis. Okay, revised national tuberculosis control program. Okay, so that also they may ask. And regarding all the communicable diseases, regarding all the non-communicable diseases, any one they can ask. ICDS also they can ask. Okay, so ICDS they may ask, but the thing which is here you have to focus more on the things like breast self examination also, and as well as I am expecting female feticide, that is very important. Okay, so very important kind of things. Okay, NACO they can ask. Okay, so that is also one of the program to eradicate the AIDS and HIV. Next one, Sanitation, environmental sanitation, nutritional assessment and all general topics you have studied that when I know. So far we have discussed lot of things. Hope you guys are getting my points, where you have to focus, completely write the answers whatever they may ask. Also don't leave any pages, try to write it down in the pen, which means you will write in the pen only all the things you have to write. Suppose epidemiological triad if you are writing, okay, so by the time if you are writing in the pencil, it is not good. Okay, you have to write it down in the pen itself. Okay, so these are the things which you have to focus more. Manslayo. Okay, that much only. Yeah, this much only is there. I will get pass mark. Human excreta disposal, no, not depletion. Both are same only, da. Hi, ma'am. Hi, da. In last important question, tell or not? Told only, no. In last important question, tell or not? Told. Any Kerala students? Oh, somebody is asking about the Kerala students. If you have any doubt, you can chat in the chat box. Otherwise I will wind it up. Okay, so nothing is there in this particular subject, you could have write it very easily. Okay, so but one thing I will tell you, most of the time you focus on those 5-year plans is there, and committees also there, that you Mudalia committee and all will be there, no? So that committees are very important, that I cannot tell you to leave that, at least study and go. Okay, you may feel difficulty also, study. Why? Because I know that it may feel some consequences in our brain, that oh, this is like a history like that and all will be have, no? So don't worry about that. Okay, so you may pass in this exam, definitely pass. Okay, so write it down correct form. Okay, if they're asking any disease condition in the epidemiology, put a one care plan. Nobody will tell you no need to put the care plan. Write it down, the care plan. Okay, whatever the referral system, how it is be taken place, that you write. Okay, prevention. Okay, that 2 marks prevention they may ask, levels of prevention. Okay, so that you study and go. So most of the things are whatever I'm telling you, those the factors which you have to focus more. Okay, so if you are listening right now, it is not possible to take down. What you do means is that take a pen paper, put a 2x speed. Okay, so don't waste your time, I'm telling you. 2x speed you put, wherever I stress no that topics, just you list it off. First revise that. Okay, I'm not telling you to study right now, revise it. Okay, so after revision, try to open the book and topic unit wise once again revision you will take place. 3 times revision from now to your up to your sleep. Okay, that is enough, that is enough, that is enough. Surely, ma'am, first chapter important topic. First chapter important topic I already told, even though once again I will tell you. Okay, so you have to focus more on the determinants of the health. Okay, determinants of the health. Okay, determinants of the health. Okay, so here it will be there. One second, I'll write it for you. So definitions of the community health nursing, that you focus. And next one is that community health, definition of community health and community health nursing, 2 definitions you will study, no? Then concepts of the health. Okay, nursing foundation already studied that one. Concept of the health and illness we already studied earlier. So next one is that health dimensions. Dimensions also you have to study. Next one, prevention and its levels. Primary, secondary, tertiary prevention level will be there, no? Primary, secondary, tertiary care will be there, no? So that care and levels you compare it and study. That is finished. That is the important question. Okay, next one, illness. Okay, regarding the illness you study. Determinants of health, already we have studied this one, nothing to worry about that. Next is public health, 2 marks they may ask, write about the public health, define public health, or 5 marks they may ask about its scope also. That is finished. Role of community health nurse you will definitely know. And community health problems in India, the problems will be there now. Communicable diseases problem, non-communicable diseases problem. Okay, so those problem you have to study. National Nutritional, Christy Thomas, National Nutritional Policy and National Health Policy, which one is important? Both are important. National Health Policy is important comparatively. Okay, diet plan, menu plan for each and every disease conditions, epidemiological triad. Okay, so then importance of epidemiology that you study. Most of the things are important. Whatever it is there also, fill the pages with the proper answer. Don't do like this. Don't do like this in the examination, like this, like this, like full cart they used to do, no? Don't do. Okay, if you are writing wrong, do like it or do like this. Don't do wrong. Study pakka thoroughly, definitely you will. MD Ajar. Hi ma'am. Hi da. Any questions? What about new booklet? Yeah, I will tell you about the new booklet. That is one of the good question you asked. So this new booklet is there. No, there they have introduced the seventh column. Yes. Okay, la. In the seventh column, your second chapter topic important. Ada, go and rewind the this one video. You will get second chapter important. Food poisoning and food intoxication difference. Yeah, that one I will finish it off. Okay, 1 second. I will finish the one thing. Okay, first I will finish it the things which is like, you know, 7 this one. Okay, which one is that? Ada? Seventh column in the new booklet. Okay, so already you people know about this one. No? Some will get the old booklet only, some will get the new booklet only. Okay, so 1 second, I will explain that one. I have that PDF. Mm, 1 second. This seventh, here one column is there in your booklet. Okay, only that much I will explain. More than that, nothing I am going to tell you because it makes you confused here. Listen, here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so somehow like this question numbers will be there. Suppose I am writing the first question answer 3 pages. Think like that. Okay, 3 pages. 1, 2, 3 pages I have written. In the question number 1, this is a question number 1. Okay, so I will write 1, 2, 3. Okay, next second question answer only I will write here. Okay, this is the 4th page, 5th page, 6th page, 7th page. So 4 to 6 or 7. Next 7 to 10. Okay, next 11 to 15. Okay, so now I will change. Okay, before writing this 5th question, I have choose that 6th question. Okay, suppose I have written 16 to 20. I have written 6th question. So my page number I have written here. 5th question I have written 21 to 24. Okay, whatever the pages you have attended, the page number you have to put in front of the question number. Okay, that column they have already given in the 7th sector or the 7th phase in your booklet. Okay, backside of the first page will be there. No, next to that 7th phase is there. There they have given. Okay, so your invigilator will going to explain you that you have to follow that much only. Hope you understood. Now coming to the next difference between the food poisoning and the food intoxication. So here no, food poisoning is that the caused infection consuming the food and contaminated with the living. Okay, so whatever we have consumed, no, so that contaminated by the living microorganisms, so that such as like bacteria, virus which will be present in the food that I had consumed, that is what food poisoning. So now it will come to the food intoxication. So which is going to be tell you what the question is that, yeah, that only, which is going to tell you that caused by consuming the toxins already present in the food. Okay, so whatever the toxins means unwanted things, okay, so which is harm for our health, which is present in the food that we have consumed, it is already present in that. Okay, so that we have consumed, that is called intoxication. Okay, so here the microorganism grow inside the body and cause the illness, but the toxins are directly cause illness. Okay, so in the toxication which will cause directly the illness, but here no, inside it will go, bacteria will grow in the stomach and that will going to cause lot of, what you will get, vomiting, diarrhea, that this and all the signs and symptoms will come, no. So that is the thing. Next one, symptoms are usually appear after the survival hours or days. Okay, so once you will consume, later on it will come, but in the toxication what it will be happen, it will come like very quickly. Okay, so if you take any kind of toxic objects, directly it will going to be supposed to be active. Okay, so supposed to show, that is the thing. Okay, so now you got the, for example here, the normal food poisoning bacteria like salmonella infections, cholera, typhoid. For here food poisoning caused by the staphylococcus aureus. Okay, these kind of will cause the food intoxication. Okay, so that is the difference. Then symptoms include fever, diarrhea, abdominal pain, vomiting will be there in the food poisoning. Food intoxication, vomiting and stomach cramps will be there. Okay, stomach pain will be there. Next, yeah, this much only we have studied. Okay, so that you focus more and study well all the programs and policies, that I can't able to explain you right now, it will take lot of time. Hope you guys are understood very well. I will wish you all the best for you guys to write examination in good way and use all the steps whatever I told you, follow those things, definitely you will get pass. Okay, go with the proper mindset and good positive affirmations. Okay, that will make sure you to remember all the answers. Thank you so much for attending my class. Okay, so we will let you see in the next class. Okay, so soon we will see. Okay, in detail we can expect all the I will going to explain all the concepts in future days. Okay, thank you so much. Keep watching Nursing Guru. Thank you.